would collect, if you were an API student or if you were a clinical pharmacist, you would have to collect all that information from the chart on the patient. Let me pull this up here. We're going to start with the Dilly case. So the information that you're looking for when you are the API student or the pharmacist is not going to be as clearly laid out as it is in these cases. All right. You'll have to you won't have to turn the pages because people have electronic records. So there's no more getting up early, getting to the hospital to try to steal the chart away from the doctor. Luckily, you'll be able to, or the provider or the nurse, luckily you'll probably be able to do that electronically from home. But you'll have to dig through the chart to find this information. Why the Dilly case was somebody who came into the outpatient clinic, and so why they came in today, and then get their HPI, their history of present illness. So what was happening that led up to you feeling weak and tired, the past medical history, the social history. So if this patient was seeing you or somebody else, you'd have to gather this information if it wasn't readily available. Allergies, and then the medications that they are taking or prescribed, their adherence. All right. And lab values, you'd have to sort through all this. All right, but this is the type of information you would have to collect to be able to work up a case for a patient. All right. All right. So we were going to go through the case information. So I did do the quiz a little bit differently in Canvas. So hopefully that it seems to have worked okay for y'all. So if you had any issues with that, can you please let me know? Because we're going to be doing another set of cases next week together. And so I want to make sure before I put them in that everything is okay on your end. When you submitted it, did you see your grade or any feedback?
No.
Okay, perfect. Because I think the last ones that you did, you saw the feedback right away. Okay. I want to make sure you are able to see feedback, but I don't want you to see feedback before everybody else finishes their quiz, because then that leads to other people potentially getting all the right answers. So I want to make it fair to everybody. I'm trying to figure out how to give the feedback after everybody has completed it. Canvas is a little different on my end and not as user-friendly as Brightspace was for the way that I can select to give feedback. So after class today, I should be able to switch this quiz over to allow you to see the feedback so that you can review the quiz in preparation for the exam. But I would pay close attention while we're going through today, because also the way I did the quiz, some of the questions didn't allow me to put feedback in the question. So your carrot or chocolate for being here today is getting all the explanations for the all the questions, right? I should have started with, how's everybody doing this morning? Thumbs up from Ernesto and Jose Avon. Thumbs down from Jesse. Are you cold or sick, Jesse? Cold? Where are you from originally, Jesse?
I'm from the Philippines.
The Philippines? Oh, okay, so you're from one of those warm climate places too. Yeah, I'm sure this is a major shock to your system. I have another person who's cold and not feeling well. Sorry to hear that. It can't be any colder than where you were this weekend. Are you still thawing out from this weekend?
Yeah, I think there were some persons that had some troubles in the dorm with heating, and they had to leave like campus. So I think it was rough for them also.
Oh yeah, I heard that from a couple of people. I can't imagine being shuffled someplace for a couple of nights.
And may I add, Dr. Hall, we were shuffled someplace that had no heat, had rats, had no blankets, no pillows, and we were given some chips and juice. It was pretty fun, though. I mean, I recommend it, you know.
It was colder than here, ironically. At least Nyla's in my room.
Oh my gosh. I am so sorry y'all had to deal with that.
I mean, more for the cleaning stage. Now, to me, like I don't, I like cold weather. I would just layer up, but the cleaning thing was nasty.
Oh. Yeah. Well, make sure you provide your feedback to the university. Unfortunately, I can't do anything about that for y'all, but your voices are powerful, so make sure you provide feedback. All right. And then we have some people that are still upset about the Ravens. Yeah. That is a big kick in the gut, isn't it? All right. So when we look at the initial information that we were given about the patient for the Dilly case, what additional information should be collected during the patient interview? Should we check for risk factors of other causes? Oh, guess I should proofread my slides. Of other causes of liver injury, sexual history, IV drug use, travel. Should we discuss alcohol use in detail? The information that we had from the case on alcohol said drinks 1 to 2 glasses of wine on Friday and Saturday nights and none during the week. Should we ask about the frequency and dosing of acetaminophen use? So in the patient chart, it said patient takes acetaminophen 1 tablet 3 times per week, denies any other over-the-counter medications. Why do I care if there's any other over-the-counter medications?
NSAID use.
Okay. Does NSAID do NSAIDs affect liver or cause elevated AST and ALT?
Especially if I they have more than 4,000 milligrams. Is that the like the maximum daily maximum, I believe? At least no, I'm thinking of acetaminophen. I think. Yeah.
Mm.
Yeah, I'm getting it mixed up. Sorry.
Yeah. So this patient has, when we look at their case, they have elevated AST and ALT, a little bit of ALK-Phos, elevated Billy. All right. A little bit elevated INR. So there's nothing here that says that the patient has cirrhosis, especially since 2 weeks ago, the patient had normal labs. So So there's nothing saying that this patient has cirrhosis. NSAIDs do not typically cause liver injury.
I have a question.
Yes.
I know about the NSAID that don't cause directly, um, the diet. We are talking about the diet, yes. So, diet or diet? What
We're
is the
talking
case?
about the DILI, the drug-induced liver disorder or liver
Oh.
injury.
Okay. So I know that the NSAIDs directly, like ibuprofen directly don't affect. But yes, I like go through the lecture and I see one of their like cause something direct by Sulindac. That is an NSAID is like cause directly like. But I think I'm confusing and mix everything.
Yeah, so
Sorry.
NSAIDs can cause acute pancreatitis because they affect the sphincter of Oddi, but they don't typically cause liver injury. We do avoid NSAIDs in cirrhosis or ascites, right? Because they cause fluid retention. So while it's good to ask about NSAIDs, that's not something that we would think would be a culprit for this patient's elevated liver enzymes and liver injury. Yes, George.
I was just gonna add, for the other over-the-counter medications, I know many over-the-counter medications are combination products and they have acetaminophen in them. So probably that's the reason.
Yes, thank you, George, for bringing me back to my original question. Why it's important to make sure that the patient isn't taking any other over-the-counters because there is acetaminophen hidden in a lot of combination drugs, especially cough and cold medications, allergy medications. And so even though the patient thinks that they're only taking, or says they're only taking acetaminophen one tablet 3 times a week, we want to make sure that we're evaluating for other over-the-counters because there could be acetaminophen hidden in other combination products. So thank you, George, for bringing us back.
Dr. Hall, I have a question.
Yes.
So just so I'm clear for my notes, so NSAIDs, liver issues, avoid. Kidney issues, we want to avoid the acetaminophen. Is that correct to say?
So NSAIDs we would avoid in patients who have ascites or who have end-stage liver disease. NSAIDs we would avoid in patients who have kidney disease because that's a topic for next fall that I will talk about with y'all. Lucky you get me for kidney disease too. But NSAIDs also can cause acute pancreatitis, which we'll talk more about when we get to that case. All right.
Dr. Hall,
Yes.
sorry to interrupt, but like an herbal, can St. John's worts like be a herbal medication that could exacerbate like kidney injury, or we're talking more about drug interactions in that case?
So St. John's wort is a herbal that I think of that has a lot of drug interactions. I don't think of it as something that affects the kidneys or the livers. But there are herbals that can affect the liver. There are some that probably can affect the kidneys, but I'm not really sure off the top of my head which ones affect the kidneys. All right. So start and stop dates of all medications, including herbal, OTCs, and herbal. So we've talked a lot about just now about over-the-counters that can affect the liver, especially those that have acetaminophen hidden in them. And we talked about herbals that can affect the liver. Does anybody remember what herbal we talked about yesterday that can affect the liver?
Milk thistle?
Yeah, milk thistle. Great. Okay, so this is meant to be active learning, so everybody should be participating, whether it's in the chat or verbally. So if you are kind of sitting back and hanging out, I encourage you to participate. So what answer did you choose for, what is the correct answer of this question?
I put E.
I'm
E,
sorry,
all
Heidi,
of
what was
these
that?
are important factors to discuss.
Okay. Heidi, did you pick E too?
Yes.
Okay, thank you. Yeah, so it is important that we have good information in this chart, but we want to verify that information because the patient has liver injury. And so we want to verify that what's in the chart is correct and accurate as we're trying to make our assessment. So we want to ask them about risk factors for other causes of injury, because we want to assess risk factors for viral hepatitis, because viral hepatitis can cause liver injury, right? And so we would ask about sexual history, IV drug use, travel. Those are things that Dr. Bailey taught you last week that can increase your risk of viral hepatitis. We want to have a thorough discussion of alcohol because alcohol is the leading cause of liver injury. So we want to make sure that the information we have about the patient's drinking is correct. We want to double check the acetaminophen dosing to make sure that she truly is only taking it 3 times a week and that she truly is not taking any other products that could have acetaminophen in them. So making sure that we have all the start and stop dates. Okay. Remember that drug-induced liver injury is rare, so we need to make sure that we have all the information correct before we move forward with our assessment. I can't remember which president said trust but verify, right? So that's what we're doing. Trust the chart, but we're verifying the information to make sure that we have all the information needed. Any questions on this particular question? Okay. What scoring scale can be used to evaluate whether a condition such as acute pancreatitis or liver disease is drug-induced and classified as an adverse drug reaction? All right, thank you for the participation in the chat, y'all. I really appreciate it. All right, so it seems like the overwhelming answer in the chart is the Naharo scale. And the Naharo scale, could we use this to determine if acute kidney injury happened to a patient from a drug? I see Haiti shaking her head yes. Do we agree with Haiti, or is this only for liver and pancreatitis? Haiti's got really good facial expressions. She seems to be second guessing herself right now. So the Naharo is for we have a yes, and I'm not sure, but yes. All right, so let's be clear that the Naharo scale is not just for liver or GI disorders as that are drug induced. It's for anything that we think is drug induced. It is a scale that we will use to see if the adverse reaction that the patient is having is related to the drug or not, what the probability of that is. What does the audit C scale tell us?
Alcohol.
Excuse me. Yes, so audit C is a screening tool for alcohol consumption and alcohol related behaviors to help us determine if a patient has alcohol use disorder. And then the Rockall score and the GBS score are two scales that we didn't even talk about this time, but they're related to the risk of upper GI bleeding. Right, so the correct answer is the Naharo scale. All right. According to the ACG guidelines on drug-induced liver injury, which of the patient's medications are known to cause hepatotoxicity? So type in the chat which ones. Okay, so this was according to the drug-induced liver injury article. And it is only asking us to identify which drugs that the patient is taking that can cause liver injury, not the ones that we think cause the liver injury, which ones can cause liver injury. So when you all answered this question, did you use this article or did you go to Liver Talks?
I use the article.
Okay. Did everybody use this article or did other people look up all the drugs in Liver Talks?
I used the article.
Okay, great. Okay. So the correct answer is acetaminophen and amoxicillin clavulanate. All right. So again, it's just asking which drugs that the patient took that could cause liver injury. And even though we might think based on the information that we found that the acetaminophen is not the cause, it's not asking us what we think the cause is. It's asking us which medications that did the patient take that could cause liver injury. All right. There are some others like the citalopram that may cause hepatotoxicity, but they're not listed in the guidelines. So it's important that we review more information to help rule out the other medications. So we would go to, where would we go to look to see if those other drugs could potentially cause liver damage?
I have a question.
Yeah.
About this. I just could only see like amoxicillin because I know that you say that the question is related to the medication that the patient is taking, but I felt that the question is more focused on the guideline. So when I go to the guideline, I didn't see acetaminophen, even that I know that acetaminophen is potentially like cause liver injury, but I didn't see. Maybe it's there, but I didn't see it. It is in the table. I look specific in the table. I only see M-size. I'm not really sure. Oh.
Acetaminophen is perhaps the best known and widely used across drug-induced liver injury.
So I just look on the table. That's why.
Okay.
Yeah, thank you.
Yeah, so it wasn't in the table, but when they're talking about intrinsic DILI, they talk that acetaminophen is one of the potential causes. And then they say here that it's perhaps the most common and widely used drug to cause intrinsic DILI.
Excuse me, Dr. Hall.
Yes.
I thought that question was talking about acute liver damage. And it was a little bit confusing for me because I thought acetaminophen was going to come in if it was chronic. But since it was acute liver damage, it was multiple option. I did pick acetaminophen as the second option, but I was wondering why we are looking at it as a cause of acute instead of something that would have come in if it was chronic.
So acetaminophen can cause acute liver damage. So think of patients who come into the hospital with an acetaminophen overdose. They are going to have acute liver damage. So acetaminophen can cause acute liver injury, but it can also cause chronic liver injury. And this
Right.
question is just asking us which of the drugs is known to cause hepatotoxicity. The question doesn't specify between acute or chronic.
Okay. Thank you.
Yep. Okay, any other questions on this? So when you're answering questions, make sure that you're only answering based on what the question is asking you. Don't read in more to the question than that is there. And make sure you're using the guideline or resource that the question is asking you to use. Okay, what is the most efficient and appropriate strategy to identify if medications may be causing liver injury? Google each medication, review package inserts, use Micromedics or Lexicomp, and access LiverTox website. All right, so it seems like all y'all know that it is the LiverTox. All right, so Google each medication, and we are not going to do that for our DI questions, right? That is not an appropriate place to look. The LiverTox website has the most up-to-date information. And it has the most comprehensive medication or most comprehensive information about liver injury for drugs. Like I said, when I looked at it earlier or at the end of last week, it had been last updated in December. Do be mindful that this is I'm sorry, I'm having trouble with words today. Gosh. The LiverTox website is administered by NIH, and right now everything at NIH is put on hold while the new administration takes over. So do be mindful that things on government websites from the NIH and CDC might not be as up to date as we are as we are used to during this transition period. We can review package inserts, but that they will likely only include common adverse drug reactions because package inserts aren't updated very often unless there is something that comes out that the FDA says that the manufacturer has to put in the package insert. So a lot of times they're not the most up-to-date information. And same with Micromedics and Lexicomp. Micromedics and Lexicomp are often mostly just the package inserts. And so again, it might not be as up to date and include recent cases or literature. So LiverTox is the most detailed information. All right, any questions on resources that we need to use for liver injury? Okay. Additional labs have returned. The patient's urine drug screen was negative. The alcohol level was undetectable. The acetaminophen level was undetectable. The hepatitis panel came back. Hepatitis C, AB negative. Hepatitis B surface antigen negative. Anti-hepatitis B positive. Anti-hepatitis B C negative. hepatitis AB positive, viral loads undetectable, and imaging negative. Okay, so what is the most appropriate intervention for this patient at today's visit? A, stop the amoxicillin clavulanate because it is the most likely cause of liver injury. Initiate treatment for Hep B infection. C, stop all the patient's medications. D, stop acetaminophen because it's the most likely cause of liver injury. Okay. Why are we not initiating treatment for hepatitis B virus infection?
Because the patient is immune.
Okay, how did you determine that the patient was immune?
The patient has anti-HBs positive, so he has antibodies for hepatitis B.
Okay, excellent. So they have antibodies for hepatitis B with the anti-HBs positive, and so they don't have an active hepatitis B infection based on the hepatitis panel. All right. Why didn't you stop all the patient's medications? Farah, why didn't you stop all the medications?
No, I feel like just amoxicillin, maybe because he's drinking alcohol, so interact with it. So I'm gonna keep him on acetaminophen.
You're gonna keep him on the acetaminophen? Okay.
Yeah,
All right.
just amoxicillin.
Okay. But why didn't we just stop all the medications?
I think you don't need to stop them all because some of them, like lisinopril, he needs that for his blood pressure, and like famotidine for his for his reflux. Those have nothing. I don't want to say nothing, but those are less likely to have anything to do with like his drug or liver injury.
Okay. Thanks for sharing, Jess. George.
Yeah, just to add to what Jessica said, I mean, the patient has been taking those medications for a long time, and yeah, the patient just presented, with this complaint, so it's most likely not those medications anyways.
Okay. Yeah, so stopping all the patient's medications is never a good choice because, as Jess alluded to, the lisinopril is for blood pressure, and it is really important to make sure that the blood pressure is controlled, and lisinopril has not been shown to have liver injury. Somebody pointed out in the chat that the citalopram is for a psychiatric disorder, and that could unstabilize the patient. All right. The acetaminophen, they were taking a lower dose and there was no levels detected. We're still not going to have the patient take the acetaminophen while they're in the acute liver injury, but that's not a chronic medication for them. We're just going to tell them to not take that right now, and we're not going to give that to them right now, but it's not likely the cause of the injury because the levels were undetectable and they were only taking one tablet 3 times a week, and that's not very much at all. And so a lot of y'all said the amoxicillin clavulanate, and that is because, amoxicillin clavulanate, it is known to cause drug-induced liver injury, and the timing fits, right? The patient's labs were fine 2 weeks ago, and they started after those labs, they started the amoxicillin clavulanate, and now their labs are abnormal. So the timing fits, right? You're like playing a detective here, right? Does everybody understand how we landed on stopping the amoxicillin clavulanate? Thanks for the head nods and the thumbs up. proof that our phone is listening to us, like meme or whatever that came across my social media was like, thank goodness for the head nodders. And I can't remember what else it said, but it was something about like giving thanks to the head nodders. And I'm like, yes, thank you to the head nodders. That's how I know I'm missing my mark or hitting my mark or missing my mark. All right. So I do appreciate the feedback because just like you all, I crave feedback to make sure that I'm getting you the information you need. All right. So what is the cutoff for elevated LFTs in order to discontinue a suspected hepatotoxic drug? Greater than 2 times the upper limit of normal, greater than 3 times, greater than 5, greater than 10. All right. So I asked you to remember this yesterday. It is greater than 3 times. I don't know why. That's supposed to be greater. I thought I switched it, but greater than.